As a physician in women's healthcare for over 30 years, there have been significant advances in reproductive health, including oocyte cryopreservation, commonly known as egg freezing. I'm Dr. Stan Yeatts. Some women ask the question, is egg freezing right for me? Oocyte cryopreservation is a means to preserve eggs that have been retrieved from women of reproductive age. Then they are stored for potential future use. The first successful egg freezing experiment was in the 1980s. Today, a freezing technique called vitrification gives 90 to 95% egg survival rate when thawed. This technology has improved significantly over the years, allowing for better outcomes in patients. Now, here are common health reasons that women might want to consider egg freezing. Those facing medical treatments like chemotherapy or radiation treatment, especially for gynecologic malignancy, women with severe endometriosis, women with a family history of premature menopause, women with unresponsive polycystic ovary syndrome, women with a history of numerous miscarriages. Elective egg freezing is a means to protect a woman's reproductive future. The process involves a consultation with a fertility specialist. Other assessments may be recommended as a general medical clearance and mental health screening. And here are common reasons that do not involve health concerns that women consider elective egg freezing. Women who want to have a child at an older age, women who are not yet ready to become mothers but want to preserve their fertility options, and then women focusing on their career or education at the time. This technology has been helpful for families who have faced different challenges. There are physical and emotional aspects of the process. Egg freezing requires a commitment and emotional maturity. Before deciding on egg freezing, women should understand the success rate depends on age. According to research, women under 35 have a higher success rate than those between 35 and 37. For those above 37, the success rate is generally lower, but still feasible. Frozen eggs can remain viable for 10 years or more. A comprehensive history and physical exam is a foundation for the assessment. The process includes blood work, including the anti-Mullerian hormone level, or AMH. The results can be reassuring that the woman still has the potential for ovulation. Then her eggs may be available for retrieval. A pelvic ultrasound is performed for general pelvic anatomy, including ovarian evaluation with an antral follicle count. This information also is an encouraging sign that ovulation is possible. In preparation for the retrieval, here's what may be involved. Optional hormonal medication may be used to synchronize follicle development. Then daily hormone injections are performed to stimulate egg maturation. There are regular ultrasounds to monitor the situation. The retrieval procedure involves light sedation and typically takes less than 30 minutes. After eggs are retrieved, with ultrasound guidance, they are ready for storage. The actual freezing cycle takes about 14 days. Now, recovering from an ovulation stimulation and egg retrieval process can take some time. You may experience some side effects such as bloating and nausea, fatigue, headaches, mood swings, and emotional changes. There is a significant increase in the use of assisted reproductive technology, or ART, in conjunction with the egg freezing process. ART involves using fertilization techniques outside of the body, such as in vitro fertilization, to help the woman with a successful pregnancy. Some common forms of ART include in vitro fertilization, intracytoplasmic sperm injection, donor egg or donor sperm, embryo freezing and embryo storage. And having a supportive family and friends can play a significant role in your journey. Then the next step is the in vitro fertilization process. Here's what to expect. IVF involves fertilizing your eggs with your partner's sperm or donor sperm. Fertilization is attempted outside the body in a sterile laboratory dish. Embryo culture allows the embryo to develop for several days. Then embryo transfer involves transferring the embryo into your uterus. To summarize important points, Here's some common questions and answers to emphasize. What is the best age for a woman to freeze eggs? Well, the best age to freeze eggs is typically before the age of 35. How long does the egg freezing process take? The egg freezing procedure typically takes about 14 days to complete. What are the risks associated with egg freezing? The risks associated with egg freezing are relatively low. Medication to promote egg maturation infrequently results in pain from ovarian hyperstimulation syndrome. Infections from the egg retrieval process are possible since it requires a minimally invasive procedure. There are rare birth defects that could also be a coincidental result. Can frozen eggs be used with a history of endometriosis or PCOS? Yes, you can use frozen eggs if you have a history of endometriosis or PCOS, but you should discuss the specific situation with a fertility specialist. How do I choose the right fertility clinic? Research local fertility clinics to learn their success rates, patient reviews, and staff experience. If you're considering egg freezing, here are some additional resources to help you get started. The American Society for Reproductive Medicine, a professional organization that provides information on fertility treatments and egg freezing. The Food and Drug Administration is a government agency that regulates fertility medications and provides information on egg freezing. Centers for Disease Control and Prevention, the CDC, a government agency that provides information on fertility and reproductive health. Well, hopefully this information has been helpful. Egg freezing is not necessary for every couple. The option of egg freezing depends on your specific situation. You may find other beneficial information on our website at storkadvisor.com. Our desire is for your family dreams to come true. This is Dr. Stan. Thank you for joining me today.